Lectures from the Academy. Welcome. My name is Chrissy Dawn, and for the next few minutes I'm going to share with you a lecture from the Blue Heron Academy entitled, No Second Opinion. This lecture is another podcast in a series of podcasts taken from the lectures of Dr. Gregory T. Lawton at the Blue Heron Academy of Healing Arts and Sciences from 1980 to 2022. No Second Opinion has been presented to the students of the Academy's medical massage and holistic health programs as part of their training in manual therapy and mind, body, and spirit medicine. No Second Opinion. Christy worked on a factory conveyor belt. Her job was to pack boxes with products to be shipped out to customers of the international company that she worked for. Christy had been a hard-working and loyal employee of this company for 17 years. The tasks involved in her job were very repetitive, so hour after hour, day after day, Christy stood on the production line and packed shipping boxes. Somewhere along the way, among those thousands of boxes, Christy developed pain in her right hand, wrist, and forearm. Her company had a company doctor, so Christy was sent to see him. The doctor was a locally prominent and highly regarded orthopedic surgeon. Due to the repetitive nature of many of this company's jobs, the company had several workers' compensation claims due to on-the-job injuries. The company doctor diagnosed Christy with carpal tunnel in her right wrist, and she was scheduled for carpal tunnel release surgery. In carpal tunnel, neurological symptoms result when inflammation with swelling occurs around the median nerve in an anatomical location called the carpal tunnel. Since the condition is caused by repetitive movement, the simple fix is to rest the affected extremity and to reduce the inflammation. From the viewpoint of holistic health care and medical manual therapy, tincture of thyme combined with anti-inflammatory diet and herbs will heal this condition without the need for surgery. But Christy was sent to a surgeon, and surgeons make their living performing surgery, and so Christy underwent carpal tunnel surgery and physical therapy rehabilitation after the surgery. Why do many workers end up with carpal tunnel surgery? Well, as was mentioned before, surgery is how surgeons make their living. They don't make their money by not doing surgery. Surgery is also performed so that the worker can return to the job and activity that caused the condition as quickly as possible. If the employee ends up with prolonged disability, in other words, the carpal tunnel surgery fails, and after a certain number of weeks on workers' compensation, their employment is often terminated. What the worker does regarding their condition and for employment after that is their problem. Christy's carpal tunnel surgery was deemed to have gone well, and after healing up and completing a short course of physical therapy, Christy was released back to her job on the line. Very quickly after returning to work, Christy's original symptoms of pain and weakness in her hand, wrist, and forearm returned. Christy complained of this pain and weakness, but her complaints fell on deaf ears. So after several months of no further help from her employer or the company doctor, Christy sought out help on her own. What Christy did not know was that carpal tunnel surgeries fail about 50% of the time. So it was a toss-up as to whether the surgery would help her or not. Her surgeon knew that before he performed the surgery. How did he know? Because 50% of the time, a second surgery must be performed. Christy's continued pain and disability is what brought her to my clinic in Grand Rapids, Michigan. I examined Christy from her neck to her fingertips, and I found problems in her lower cervical vertebra, pain and stiffness in the lower neck muscles, limited range of cervical motion, and what I suspected was entrapment and compression of brachial plexus nerves. Christy inquired as to whether my treatment would include chiropractic cervical adjustments, and I told her that I preferred mild mobilization techniques, but I felt that we should get an X-ray first. I send all my patients that need imaging to a medical imaging center, so Christy was sent to the closest imaging center with a prescription for cervical X-ray series. The X-rays were taken and read by a medical radiologist. Christy, had a broken neck. In fact, she had 2 unhealed, fractured lower cervical vertebrae. Christy had no memory of a neck injury, a fall, or any accident that might have caused these 2 fractures. Having no memory of a traumatic injury is not all that unusual. If there was an injury with a concussion, then memory loss is common, or if there was the use of drugs or alcohol, even certain prescribed medications, a blackout and fall are possible. How the fractures occurred remained a mystery. Had I adjusted Christy as she had initially requested, I might have severely injured or paralyzed her. My suspicion was that Christy never had carpal tunnel median nerve entrapment, and that was Christy's suspicion as well. After her diagnosis of fractured cervical vertebra, Christy returned to her employer and complained about her carpal tunnel surgery and treatment. After 17 years of loyal employment, their response was to fire her. I referred Christy to a local medical physician that I frequently referred patients to, and she received treatment to heal and to stabilize her vertebral fractures. That care, along with physical therapy and continued soft tissue treatment in my office, eliminated the pain and weakness that Christy had suffered from for many months. Much of what Christy experienced due to a misdiagnosis and unnecessary surgery would have been avoided with a second opinion and a $50 x-ray. This has been your narrator, Chrissy Dawn, and it has been my privilege to share this lecture and podcast with you. I hope you will continue to listen to our lectures from the Academy podcast series. Until next time, stay healthy.